Hello everyone, hope you all are doing good. Today we are going to discuss a new research project under Dr. Jaya Gupta and team. The article was published in IGRH journal, Homeopathic Therapy in Cervical Spondylosis Pain Management, a randomized double-blind placebo-controlled trial. If you see the previous studies which has been conducted in the cervical spondylosis, there were three major studies. One was on individualized homeopathic medicines for the treatment of cervical spondylosis. The second study was using bowel nosodes, which was selected based on the microorganism present in the stool culture. And the third study was done by CCRH itself, where they have taken a comparative study between LM potency and centesimal potency. The first two studies we referred to have a little methodological flaws. The third study, LM potency versus centesimal potency, was able to show a better result in LM potency compared to the centesimal potency. So these were the previous studies available in this particular area. This particular study, the current study what we are going to discuss right now, is a multicentric, randomized, double-blind, placebo-controlled trial, and this particular study was done in 7 centers of CCRH. Before initiation of the study, ethical committee clearance, CTRA registration, as well as informed consent form was obtained from the participants of the study. While we consider the inclusion criteria for the subjects, both male and female participants were included, ranging from the age of 30 to 60 years of age. The participants were selected for the study if they were having at least a 2-week span of the last 2-week span of pain in the suboccipital region or interscapular region, or there must be at least 1 or more episodes of stiffness in average per month for the last 3 months, and as well as radiological findings were supposed to be present. Additionally, they were giving importance to VAS pain scale with 4+ markings, plus the people or the patients who are under another treatment, either an anti-inflammatory drug or any other forms of treatments, were not included in this particular study. Regarding the sample size, initially they have estimated 116 sample. When they consider around 20% of dropout, they have added on to 140 sample size, where 70 will fall under control group and 70 will fall under study group. For the purpose of randomization, they have used www.randomizer.org. Using this, they have categorized into 2 groups, which was coded as series 1 and series 2. Only the pharmacist and the investigator was having the knowledge about who belongs to the series 1 and series 2. And this series 1 belonged to control group and series 2 belonged to study group for 4 centers, and it was ulta for the remaining 3 centers, where series 1 was study group and series 2 was control group. So like that, they have randomized the whole study. For the purpose of screening, they have used ESR, C-reactive protein, RA factor, serum calcium, serum phosphate and serum alkaline phosphate levels, as well as X-ray of the cervical spine up to C7. Regarding the intervention, the medicine was selected in 30th potency. The predetermined or pre-selected group of medicines were Paris quadrifolia, Calcarea carbonicum, Gelsemium, Cocculus, Simsifuga, Rastoxicodendron, Causticum, Radium bromide, Calmia and Lactanthus. So based on the acute totality, they have selected the medicine from the previously mentioned group of remedies, and they have prescribed in 4 pills, 6-hourly interval for 7 days, where they get 3 doses a day. So this was the span that they have used. The outcome was recorded in cervical spondylosis using the pain management scale, that is CBPMS, for the movement and tenderness, and VAS pain scale was also used, followed by quality of life was assessed using patient's global impression of change scale. For the statistical analysis, they have used independent sample t-test and chi-square test for comparing the remedy and the placebo group at the baseline. and Friedman's test to determine the difference between the groups on the baseline as well as on the 3rd day and 8th day, and in the Mann-Whitney's test for the quality of life assessment in comparison between the groups. Regarding the results, if we see, a total of 498 people were screened for the study, and a number of 136 people were selected as they were matching up with the inclusion criteria. Out of 136 individuals, 36 were men and 100 were female. This was again divided into homeopathic group as well as the placebo group, where homeopathic group got 67 volunteers and control group got 69 participants. Further, during the process of study, there were 2 dropouts, one in each group. So finally, we had a some number of 66 participants in homeopathic group and 68 participants in the control group. In the homeopathic group, 53% of people showed marked improvement, whereas in placebo group, it was 47.1%. Mean improvement in the homeopathic group was 60.36% and in the placebo group was 48.66%. Using the cervical spondylosis pain management scale, it was estimated that homeopathic group had shown improvement in pain in 56.18% of individual, and in placebo group 46.45% of people were showing improvement. Regarding the stiffness, homeopathic group showed 55.70% improvement and placebo group showed 48.75% of improvement. Regarding the limitation of movements as well as the tenderness, also the homeopathy had an upper hand comparative to the placebo group. Regarding the quality of life, homeopathic group had 27.95% better improvement compared to the placebo group. Just by looking into the observations, we understand that homeopathy is better than the placebo, but as we go into the statistical analysis of the data, we couldn't find any significant difference between the groups. Maybe this was due to a span of 1 week treatment. The study have gone only for 8 days per patient. So if we have a longer duration of time to intervene between the treatment, so we may have a better results. So this is the outcome that they have understood in this particular study. In this study, the majority of the drugs which were used or the commonly repeated drugs were rustoxicodendron, calcarea carp, calmia and Paris quadrifolia. So these are the remedies which were commonly repeated. Overall, we can understand cervical spondylosis can be helped with homeopathy, but in an initial phase of 1 week span, we couldn't show any statistically significant difference between the placebo and the homeopathic group. Hope it was useful for every one of you. Let us meet again with another interesting research. Thank you.